Hello everyone. Today we'll be discussing hyperthyroidism and how to approach the hyperthyroidism questions in USMLE Step 1, Step 2, and Step 3 exams. So when you are attempting the question, the steps that I used to do when I was taking the exams and when I was practicing for USMLE was I used to read the question and I would make a diagnosis. Then I would see the options and I would rule out according to the diagnosis I made. So that's basic trick when you practice a lot of questions. You do UL, you do emboss, or any sort of question bank you are doing. That question bank trains you to rule out the options and read the question, make the diagnosis all within 1.5 minute. 1.5 minute is actually the time you have to solve the question. So today, as we are discussing hypothyroidism, and we are actually making this video and in the live session to address the very concern of the problem that how to solve the question actually that comprises of hypothyroidism problems. So let's suppose there's a question like a female comes with palpitations, TSH is high, and T3 and T4 is also high in the labs. You see diarrhea, you see the patient is complaining of weight loss, and all the complaints that are present in hypothyroidism. So you see that you have to classify according to the labs. Most of the time, the labs are given in the question, and you have to classify whether the TSH, T3, and T4 are high and or low. If you go into the physiology, I'll definitely make another video for the physiology of how the hyperthyroidism or thyroid gland works. So if we make the um, uh, video for the, I have to take a break. Take a break. I'm really sorry I had to go. There was someone on the door. So we were at the hypothyroidism, and whenever the question says the TSH is high, the T3 is high, T4 is high, this means the problem is in the pituitary gland. And the very next step would be to go to the MRI of pituitary and brain, where we will be able to see pituitary adenoma, functional or non-functional, and we would go to the diagnosis. Now, there's another condition where TSH is low and T3 and T4 are high. That's how the thyroid gland works. T3 and T4 negatively inhibit the TSH, due to which it is low. Now, here's a catch. The catch is if there are clinical symptoms of goiter or grave disease, this means that you have to go straight to the diagnosis without going into further evaluation. Now, in Graves' disease, as we know that TSI antibodies, they directly stimulate the thyroid gland to make the thyroid hormone, which in turns negatively inhibits the TSH. And we have the clinical symptoms. So right now, what we have to do is just go straight to the diagnosis. We don't have to go to other investigations. So that would be pretty simple. But what if they've given in the question that only TSH is low, T3 and T4 are high and there are no clinical symptoms, then we have to rule out the insidious causes. Some other causes like thyroiditis, it presents in a different way, like exogenous thyroid intake. Okay, and like we can say um, thyroid carcinoma. Yeah, in the start they make thyroid hormone uh, more. It goes into hypothyroid state and then into the hypothyroid state. So there are various other causes that we have to rule out. So the next step would be to go for the radioactive iodine uptake. This actually helps to uh, classify between hyperthyroidism, which is due to functional thyroid hormone, or exogenous causes. Okay, so if the radioactive thyroid uptake is high, this means that it is thyroiditis, toxic, toxic multinodular adenoma. Okay, and if the radioactive thyroid uptake is low, then this means that the thyroid hormone is hypofunctional. There's something else that is stimulating it. Now, the next step would be to rule out that problem with thyroglobulin. That would be the next uh, profile or lab that we have to go for. Now, if thyroglobulin is high, this means that thyroid hormone is working. There is no exogenous cause. Thyroglobulin is the basic part of the what we say thyroid physiology, which helps in making of thyroid hormone. So if thyroglobulin is high, this means that there is a functional cause, and it could be thyroiditis. Thyroiditis basically leads to hypothyroidism, but it has three phases. There's a hypothyroid phase, there's a euthyroid phase, and there's a hypothyroid phase. And then there is exogenous thyroid use, where thyroglobulin is low because patient is taking thyroid by herself or by himself to lose weight. Yes, people do these things to lose the weight. So this leads to hyperthyroid symptoms along with the suppression of TSH and already increase in T3 and T4. So these are the basic flow charts that we have to follow. I would definitely repeat this thing. The first thing we would do is TSH, T3 and T4. If TSH, T3 and T4 are high, this means it's the problem is in there's a secondary problem. It's in pituitary gland. If TSH is low and T3 and T4 are high, this means the problem is in thyroid. If there are clinical symptoms, go straight to the grave disease and treat it. If there are no clinical symptoms, the next step would be radioactive iodine uptake. Radioactive iodine uptake will lead us to the conclusion whether it is functional, or I would say the thyroid hormone is given exogenously or it is the functional problem. So if the radioactive thyroid uptake is high, this means this thyroid hormone is hot. It is synthesizing hormone. It could be toxic multinodular adenoma. Okay, that's also like the Graves' disease, but has different presentation. There are multiple nodules that are swollen. If radioactive thyroid uptake is low, then this means that the thyroid hormone gland is cold right now, and there must be other problems. Then the next step is the globulin. If the radioactive thyroid uptake is low, then the next step is thyroglobulin. So if thyroglobulin is low, this means that the thyroid hormone is given exogenously. If thyroglobulin is high, this means that it is thyroiditis that would eventually go into hypothyroid state. So these are the basic mechanism and flowcharts. I hope this video was helpful. And in the next subsequent videos, we'll be discussing the other problems, and definitely we'll be going into physiology too. But right now, our main focus is how to solve the problem and get to the conclusion when we have these questions in USMLE exams. Okay, good luck. यार वो बंद